because that would lead long-term to wear and tear of the bones, which is exactly what we have in this osteoarthritis piece. You can see the patella has been bent over the tibia, revealing a pair of very worn femoral condyles. Here, we can see that the bone looks too smooth, almost as if it had been sandpapered, which it has from excessive abrasion over time. So, osteoarthritis is essentially just the natural wear and tear of the cartilages between bones that eventually everyone will have at some point in life. Here we have this knee example, but you can also get it, for example, in the hands or in many other joints. Essentially, if you get like two hard objects, two stones, and start scraping them against each other, they are eventually going to get worn. So, what happens to the bones is exactly the same thing. When you talk, for example, about many bones, we have many different types of cartilages. Our articulations, joints, however, we usually have cartilage between them to smoothen the movement. As cartilage starts to become damaged and tear, so the bones start coming into contact with each other, and then you can develop some abnormal formations, for example, such as osteophytes. Here it shows a spine. You can clearly see, for example, the iliac bone, the ischium, the sacrum, and all the lumbar, thoracic, and cervical vertebrae, all the way up there, up to a part of the cranium up there. You can see right above axis and atlas, they've actually placed the occipital bone a part of the cranium. And one of the things that this specific piece is trying to demonstrate is osteoarthritis. There are many pieces of osteoarthritis here, and this one talks about the long-term damage of the touching between the bones and how it can affect the vertebrae.